Today I want to go through some general tips for injectable biologics. These are the biologics that are in an auto-injector rather than a pre-filled syringe. The first thing I want to mention is that these should be refrigerated. You want to keep these drugs refrigerated, although there are some biologics that say they can stay out at room temperature. It's still a good rule of thumb to keep them refrigerated until you're ready to use them. When you are ready to use them, you want to remove them about a half an hour before you're ready to do your injection. This will allow the drug to come to room temperature and make it somewhat more comfortable. You can use them right out of the refrigerator, but some people find that cold solution going in to be a little bit uncomfortable. So about a half an hour is enough to bring that syringe to room temperature. The next thing I want to talk about is if your auto-injector does not fire or does not start when you push the button. What happens sometimes is these auto-injectors need to be on a flat surface. So when you go to use your auto-injector, maybe it is not even all the way around the tip of that injector. So what you can do with that is take it away from the skin and then pinch a piece of skin that's of course big enough to hold the auto-injector. What you would do is then place the auto-injector against that flattened, harder skin and try to fire it. This usually will work. Sometimes it takes a little practice and you just have to take it away and come back a couple of times before you get it to fire, but usually that's the problem. The next thing I want to talk about is if you have a painful area when you do your injection. Some people say that these medications sting or burn, and some people say they don't bother them at all. But I don't know which of those people you are or you're going to be. So what you want to do is if you do find that it's painful or that it burns, go ahead and put some ice on that area for about 5 minutes before you put the injection in. And this will numb the skin and make it a little bit more comfortable for you. Now, what would you do if afterwards it's painful or there's a red itchy spot? Again, you can apply ice. And if it stays itchy, you certainly can use some topical cream, like a Benadryl cream, to apply to that area to take away some of the itch. The last thing I want to discuss are sharps containers. Sharps containers are where you're going to dispose of your syringes, whether they're a pre-filled syringe or an auto-injector. And in most areas, they can actually be put in a puncture-proof container, then sealed up and put in your regular trash. However, most of these pharmaceutical companies that make these biologic drugs are providing sharps containers to the patients that use them. So I would contact the pharmaceutical company, find out if they have a sharps container program, and get yourself enrolled in that. What they will do is send you a sharps container and a prepaid box. And when your sharps container is full, you put it in the box, seal up the box, drop it in the mail, and it's all paid for, and the pharmaceutical company will dispose of the medical waste. So those are just some general tips for today. I will see you again.